Welcome to the Heart of Innovation, 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Abbott. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Well, don't ever tell a patient ever again that they're too young to have poor circulation in their legs, known as peripheral artery disease. Along with an increase in adolescent diabetes to type 2 diabetes, according to the CDC, doctors telling patients they are too young is likely a big culprit in what has led to a higher number of advanced stage poor circulation, or P.A.D., known as critical limb ischemia, or CLI patients in people ages 18 to 40. It used to be an old person's disease. Well, you know what? Not anymore. A new study in Science Direct, just out on April 14th, shows a disturbing trend in a younger demographic of CLI patients under age 40. Even more, this new Science Direct study found a higher number of amputations with higher rates of surgical procedures, such as bypasses, and fewer minimally invasive approaches in hospitals. Very strange, because if you think about diabetic patients, which we think these patients might be, especially type 2, they typically get more disease below the knee, which often requires wires and balloons in a minimally invasive method to get clear into the small vessels in the foot. So throughout the show today, we're going to get a little more into that study, and that's going to lead us into a conversation about democratizing access to testing for P.A.D. We have John Romans, CEO of a P.A.D testing device company called Biomedics. Their device is called PADnet. He's going to be talking about that and a partnership with my organization, the Global P.A.D. Association, that's going to democratize access to testing. So really exciting show planned. John, before we get started, how is everything going this week? You've already had a busy morning. I mean, you're not only seeing piggies during the week, but you're, out there on the soccer field, on the lacrosse field on Saturday mornings, helping to keep those collaterals growing in your kids.
Yeah. Good afternoon, Kim. How are you? I'm doing, we're doing well. We had a busy week. It was interesting because last week you did the show and I was on location with Phillips doing that educational event. And we did briefly touch on what you were referring to in the Journal of Cardiovascular Revascularization Medicine about trends in limb loss and critical limb ischemia in young adults in the United States. So certainly this should be an interesting conversation. Those educational events that we participate in are fantastic because it goes to show that this disease is very prevalent, and there are physicians out there that want to learn more about it and become better interventionalists and surgeons and treat patients the best they can. But yeah, today was busy. We're out on the soccer itch, as they call it, and just hopefully the weather gets a little warmer. It's a little chilly here in Columbus.
It's nice out here in California today, but yet I haven't gotten out to enjoy it because I've also been sitting here, and you were mentioning those continuing education events that doctors attend, and there's one actually on right now virtually, put on by Pegasus, Dr. Robert Beasley out of Florida, Dr. Miguel Montero Baker, a vascular surgeon out of Texas. I also saw Dr. Jay Matthews out of Florida, and even Dr. Peter Soukas out of Rhode Island. And Parag Patel, I can't remember where exactly he is, but Dr. Parag Patel was on there as well. And so I was catching a glimpse, and before we began here with John Romans, the CEO of Biomedics, he and I were peering in. And he says, "Where to go?" And I'm like, "Oh no, we had to pull it down because the show's going to start. Our show's going to start." So but that's going on all day. So a lot of doctors do take time, in their spare time, even like you going down to San Diego, flying clear across the country to go to these events. But then you have, folks like Pegasus that are doing ones virtually on a weekend to democratize access to those physicians who can't get away.
Yeah, I mean, it makes sense to not that we all want to, completely live and breathe and spend all of our hours doing this type of work. But there's only so many hours in the day, and if you can get something done on the weekend, and even if it's just jumping on for a half hour or an hour and learning about something new, I think it's very beneficial. So kudos to those physicians who are, I'm not familiar with Pegasus, but yeah, kudos to those that are doing God's work, as we say, trying to get better.
You know, you joke about we don't want to live, eat, breathe it. But last night I was on everyone in the world knows I'm single, 48 and single, right? So I'm on Bumble. So no surprise. I'm on Bumble, this dating app. And
All
you know, a
right.
couple of years ago I joked that I met an orthopedic surgeon, and he asked me what I did. Well, that's always a loaded question. Of course, I'm going to get on my soapbox, especially with another doctor, and get excited about all the advances in saving life and limb. And he had this funny look on his face, and he says to me, "Oh my God, you mean they can open up those vessels below the knee and into the foot? I've been just cutting off legs." And so I thought, well, I just, I should be dating really more doctors. Maybe that'll help to spread the word that life and limb can be saved. And the same thing last night. I had an amazing emergency room doctor that is touring, the Bay Area right now, that happened to show up in my location, and he's saving life and limb here in the Bay Area at a couple of the hospitals. He's from Washington, and he was like, "Oh wow, you just taught me something. I'll be sending some patients your way to help facilitate limb saving care." He's like, "Thanks."
You
So
know,
maybe I
not
should
to,
stay single.
well, yeah, it's a perfect example of mixing business with pleasure. But
Yes.
what's always, again, it's just the fact that physicians, and again, I don't know the latest and greatest in orthopedic care or emergency medicine care, but the fact that people are like, oh yeah, I didn't know they could do that, just reinforces what we need to do with respect to education, not only on the patient side of things, but
Yeah,
also physician side of things for PAD and CLI.
exactly. So I think it's about time for a moment of inspiration before we get into our big conversation of the day.
Dr. John Phillips' spectacular vascular moment of inspiration.
So I have a quote today from Franklin Delano Roosevelt. I'm currently reading the book called The Arsenal of Democracy. So basically, it is around the time of World War II when we started mass producing, among other things, the B-24 bomber to defeat Hitler. And so I thought, all right, let me find a good FDR quote. And then I realized, you know what? My father used to say this, so this is a 2-for-1. But I like this one quote: "Never put off until tomorrow that which you can do today." And
An oldie but goodie.
an oldie but goodie. But then the next one is, I like this one too: "By failing to prepare, you are preparing to fail." So, a lot of what we do in the medical space is, you prepare for the worst, hope for the best. And you can sometimes get we call it paralysis by analysis, and that can paralyze you too much. So it's a fine line of kind of working through these things. But my quote and my pledge, or my plea to everyone out listening: do today and don't put things off.
Yeah, that is so important. And be ready to be ready to be ready to be ready. My favorite quote. Okay, we're gonna be ready to be ready, be ready for a very powerful conversation. Joining us will be John Robins, CEO of Biomedics. Stay with us and don't go away.
Fit Old Dog's aging training tip number 1 is never give up. In 2010, I self-diagnosed an aortic aneurysm, and Joe Fulton fitted me with an AA stent graft. I needed to modify my Ironman training to protect that stent, which I did by reducing hip flexion on the bike and avoiding use of the rowing machine. Fortunately, in 2011, I finished the Lake Placid Ironman with that stent graft. However, it was displaced in 2013 in a bike wreck, and Tara Mastracci of the Cleveland Clinic repaired it. I was very lucky in that respect. However, it wasn't over yet. In 2014, I developed calf pain in marathons, and then real problems began. What a pain. However, no pulse could be detected in my right foot. In 2015, I had an ABI test, in Mark Farber's facility, and he confirmed I had P.A.D. However, in 2013, with P.A.D., I managed to be third in my age group in the World Half Ironman Championships in Finland, using Fit Old Dog's training wheel, which begins with the study of awareness. Tip number 1, never give up. You never know what you can do if you try.
This is 860 AM, The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. So, Kim, before we jump into the democratization of, P.A.D. and some of the new technologies
Testing.
out there,
Yeah.
how did you stumble across this article I believe it's in Cardiovascular Revascularization Medicine? Was this sent to you, or were you just kind of?
It was posted actually on LinkedIn by
Okay.
Podimetrics. And Podimetrics has a device that is used to help detect ulcers before they emerge in diabetic patients. And the CEO, John Bloom, posted it. And then our global advocate for P.A.D. out of South Africa, Sally Hendricks, ended up also tagging me. So I got tagged twice in it. And so I thought, I'm supposed to read this article. And of course, I'm glad I did.
Well, I would just say that oftentimes, and I'm as biased as the next physician, and I'm a guy that kind of lives in this space all the time. When we see somebody who's under 40 that might have the P.A.D., you're scratching your head like, are we sure this is P.A.D.? But to your point, the fact that we have this rise in pre-diabetics and then ultimately type 2 diabetics with the obesity and the poor diet, it doesn't really surprise me. Frankly, I've never seen someone under 25, I think, that actually had true peripheral arterial disease. Mm-hmm. But the young white females who are smaller body habitus and smokers, we see that. I'm seeing that more common now. I mean, it's not super common, but I'm seeing that more often, I think.
Here's something that might be worth thinking about. How many of these might have been a misdiagnosis as P.A.D., especially in the white women, as it might have been popliteal entrapment?
Yeah, I mean, I've
seen the misdiagnosis with that.
Yeah, that is, yep, and that is a misdiagnosis, particularly in young athletic females, where the muscles is trapping, or just by the way the artery kind of comes out behind the knee, it gets trapped. But honestly, true atherosclerotic peripheral arterial disease is pretty rare in people without risk factors. But I mean, they mentioned risk factors here in this article. So diabetes, tobacco abuse. I mean, I think if we just got rid of tobacco and really focused on lifestyle modification, we could nip this in the bud not nip it completely, but at least start to prune it back a little bit.
And, with our organization, we have had quite a few. We've seen an influx as well in the number of patients that have come to us under the age of 40 with their doctors refusing to even offer any sort of exam, a vascular assessment of them, saying it's not even possible. It's not even worth our time to order an exam. Go ahead, eat a banana. Not kidding. Eat a banana, go get blood work to test, for any sort of nutrient deficiency, magnesium, potassium, whatever it might be. Oh, maybe you need to drink more water. I mean, all of that jazz. And literally most of the ones that came our way did in fact have P.A.D. And they were just brushed off. And so that was one of the factors for us saying, hey, we need to democratize access to P.A.D. testing. We need to let people know where they can get the testing in clinic, because I think that really democratizes access, and it reduces the amount of time between a patient actually complaining of symptoms and getting diagnosed and then to getting treatment, so that it doesn't escalate to the advanced stage of CLI or critical limb ischemia sooner rather than later. And so one of the issues that you and I have talked about before in this is that a lot of primary care doctors don't know very much about P.A.D. and they're not following this as much as we are on a daily basis. And so that's why there's a company called Biomedics, and we have John Romans, the CEO, who's on right now. And what I like about what they're doing is that they're targeting the primary care clinics and the podiatrists, because those are typically frontline, especially for diabetics, because diabetics go to the podiatrist to get their nails cut. That's covered, right, by most insurance. And so if they can get to the primary care doctors and the podiatrists that have P.A.D. testing equipment in clinic where their staff is trained for it, they can get tested sooner rather than later by someone who is more experienced with P.A.D.
Yeah, I think that's a fantastic. I mean, so a lot of what we talk about, and I can't wait to get talking with John, because on the or off air we were just both discussing that lacrosse, and he's freezing right now in Minnesota. So I'm really excited to talk to him. But I mean, there's a couple of things. Number one, we talk about trying to be more proactive and taking care of these people.
Right.
And so it's screening tests like this, because the sensitivity and specificity of an ABI is upwards of high 90s. It's more sensitive and specific than mammograms and PSA and things like that. So how do we get these things in the hands of people who are at risk but don't yet know it? And it got me thinking real quick, because one of the things that we are doing with the men's health clinic that I'm starting, this franchise called Game Day Men's Health out of Carlsbad, California, but we're doing free PSA testing and raising awareness for prostate cancer. And so it's like any opportunity, and plus all these kind of concierge-like medical facilities are popping up. But if you can offer free testing, and obviously we eat the cost or whatever, I think in the long run you're doing the right thing. So should we welcome John?
I think so. Hi, John. Thanks for your patience.
Oh, Dr. John and Kim, thanks. It's a real pleasure. And I think kicking things off, how are the games on your end? We had a win, 11-1 on our end.
We got smoked 14-4. I actually left and went to the other soccer game. See, I'm used to watching soccer where it's like 1-0 or 2-1 or something, and I thought, wow, they're scoring a lot here. So this isn't good for us.
Well, then next time. Well, thank you for having me on. It's a real pleasure, and I've absolutely enjoyed everything I've heard so far.
Oh, good. Whew, we didn't bore you.
Timmy's still awake. This is great.
This is good. So thank you so much. And before we get into it, we can actually just mention the fact that we do have this partnership, because I was leading into it, and I love the fact that you're offering this testing equipment for P.A.D. in clinics, as frontline. And I'm curious, was this, part of, why you did that is because we were struggling on the front lines with primary care, being educated and getting the patients the order to go get, direct to these primary care, I would think would make a big difference.
It really is interesting in that initially we were focused where the specialists were in hospitals, in vascular labs. And we realized that the expertise, the personnel, the technology was readily available there. But the problem was that patients certainly didn't know how to necessarily navigate to meet up and receive the expert services of specialists. Yep. And often, if found early, these conditions can be managed effectively within the primary care. But there are some other complications with the primary care. For instance, there is just some hesitancy, for instance, in primary care about encroaching on another physician's medical area of practice. So yes. Often there was a little bit of reluctancy because there was concern that maybe they shouldn't be getting involved in diagnosing lower extremity arterial disease or looking for leg disease because another physician might not be happy about that. So these community-based collaborations, which you have been so fantastic in establishing, and we are big believers, that working with specialists to help to educate the primary care who have access and relationships with those patients. Our job is to provide them with technology and training to do these very simple, but as Dr. Phillips has mentioned, accurate studies, and then make that information readily available securely and remotely to specialists so they can work together to take care of those patients.
More from John Roman, CEO of Biomedics, coming up in a moment. Stay with us.
860 AM, The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
I love the fact that Kim and I have been doing this for so long that, right before we go on air, we'll point to each other as to who's bringing us back. So anyway,
it makes it so easy on the same page.
It does. I was like, me? She's like, yes. Okay. So welcome back, everybody. Want to continue our conversation with John Romans, CEO of Biometrics, right?
Yep.
They have a
Biomedics.
what sounds like a kind of a portable-ish ABI machine that allows for a very simple assessment of blood flow in folks that might have peripheral arterial disease. So before we went on air, John, I wanted to ask a little bit more about the trepidation that you had found with some of the primary care physicians ordering, this test. Because frankly, when I see somebody who might have peripheral arterial disease, I want to say maybe 50% don't have any non-invasive imaging that, or testing for that matter, that actually confirms it. So, I mean,
wow.
the ABI, a normal ABI is 1. Okay, so basically we've talked about this, but the blood flow and the pressure from the blood vessels, exerted, around the ankle or the arm should be equal in someone who doesn't have any blockages. So if the number is less than 1, we think there might be some blockages, potentially, most likely in the legs. So if you have a number less than 0.9, that ratio, then you're diagnosed with peripheral arterial disease, and we kind of treat you appropriately. But a lot of times folks come in and they don't have any testing, so then I have to order it, and it delays a little bit of what I'm able to do. So it's kind of nice that this is being this is available to physicians in their clinics to at least get a baseline for us to move forward.
I completely agree, and in fact, we know that access to vascular specialists such as yourself and your expert teams and facilities are a priority, and we really want to kind of make sure that the patients that you're spending your time with are those that have been identified as needing that expert service. And so this is, we think, a really exciting role for the primary care physicians who can be a frontline, support earlier diagnosis, which then comes with all sorts of exciting options on how that patient is managed. Often, by the way, they're much less expensive when you find the disease earlier.
Oh, exactly. If you want, John, Dr. John, do you want to go into just the stages of P.A.D. and why it's so important to diagnose this sooner, and how much a patient can do as a partner in their own care if they are diagnosed early to prevent it from progressing to advanced stages?
Yeah, sure. So peripheral arterial disease, there's about 220 million people in the world that have it. Of that, so for example, in the US, there's probably 10 or 11 million people. Maybe 2 million of those have critical limb ischemia, so like the most severe form of it. So when we talk about peripheral arterial disease, again, the kind of keystone of our diagnosis is this ABI that we've talked about, and the device that Biomedics has, kind of point of care, which is awesome. I think it's fantastic. But 50% of patients that have abnormal ABIs have no symptoms. And that doesn't mean that they're not at risk. It just means that the blockage isn't bad enough for them to have the aching and heaviness when they walk. But that also means we have to treat them as though treat them because they have the disease, which means change their diet, talk about tobacco cessation, talk about their blood glucose levels, make sure they're, not, if they have diabetes, make sure it's well controlled, and then first and foremost, address their lipid profiles and consider medication to reduce their cholesterol. And then if you have symptoms, we talk about how bad they are: mild, moderate, severe. And that kind of, that range depends on when the symptoms start. So someone with mild peripheral arterial disease can walk, let's say 100 yards of football field, and then the leg starts to cramp up, goes away when they rest. Moderate, it's shorter, and then severe. Patients with severe peripheral arterial disease, they'll endorse discomfort with just a short walk to potentially from the parking lot to the door of our clinic. And then those that have severe P.A.D. but ulcers, then they have that critical limb ischemia. So those are kind of the stages. But if you've been diagnosed with it and don't have any symptoms, we still want to make sure we're reducing your modifiable risk factors.
Yeah, I think that that's so important. And that's why, democratizing access for those who have high risk factors. We have the ARC Act that is in Congress right now, and it keeps stalling out. And the ARC Act would democratize access to P.A.D. testing, just as you would, have a colonoscopy covered, just as you would have a mammogram covered for potential breast cancer. What we're hoping for with the ARC Act, if it would stop stalling out in Congress, I know who the holdouts are. We just got to get the word out that, this is more prevalent and deadlier than all cancers combined, except for lung cancer. And people do not have access to the testing because insurance may not cover it. But if it's in the clinic, frontline with a primary care doctor or with a podiatrist, and they say you have a high risk factor for it, you have diabetes, you smoke, especially for those over 40, we can test you right here in the clinic, right, John?
Absolutely. And that Amputation Reduction and Compassion Act, or the ARC Act, it really is. This is one that I just don't think Congress has had the opportunity to fully appreciate what's being done, in that for people to understand that all that is being asked is that a quick and easy study is done before an amputation. Just don't amputate before looking to see if the limb can be saved. And I really do hope that this comes around and is supported.
That's like jumping out of an airplane before you figure out you have a parachute. Makes absolutely no sense to me.
Completely agree.
And coming up right here on the Heart of Innovation, we'll have more with John Romans and details of this partnership between the Global P.A.D. Association and Biomedics, and where you can find out about P.A.D. testing sites near you. So stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. Let's jump right back into our conversation. So, John, your device, PADnet, the one that I'm looking at right now, looks like a shin guard that has the kind of it's pretty sleek looking. It's small. It's a lot different than the device that we have in our hospital that kind of looks like a 1970s IBM computer. So, I look at that device and I say, well, there's a lot of bells and whistles on this thing. It must give us a better ABI reading and toe pressure reading than your device, but you would argue that might not be the case, right?
I would argue that if you looked at your first cell phone, it probably looked more like your shoe than your phone does today. So similar changes over time. What is exciting is that while it's a much smaller device, it is a fully functioning, powerful physiologic device. So it should be able to do the studies. To be certain, there is equipment that, without question, you have in your lab that is far more expensive, requires expert personnel to operate it. But what's great is today, technology like our PADnet technology is easily used in a primary care setting by their team. They can perform these studies like an ABI to do a quick screen and then get that information readily available to someone like you, so that you can remotely review that information, provide a diagnosis, and then provide guidance on treatment plans, which I think is one of the things that the primary care community really enjoys, that they get that remote access from a specialist like you, and there isn't any compromise to the level of care to the patient.
Yeah, that's great. I mean, can we talk profit and loss real quick? So
Sure.
let's say I'm a primary care doctor. I'm listening to the show, and hopefully there are many, and I'm interested in getting your device. Walk me through what that looks like, not only with cost, but how do I get that money? Because again, at the end of the day, as much as we hate to say that it's a business, so you need a return on your investment, but walk us through that and then kind of the training that has to happen. Because in our lab, we have trained ultrasound sonographers who have gone to school to do, among other things, ABIs.
Yeah, that's great. And there's no question. In fact, I think, like many parts of medicine, primary care, often it feels like the only way to maintain the revenue that you've had in the past is to see more patients, and to see more patients, that means even less time with each patient. And care suffers, physician and care provider burnout are rampant, especially post-pandemic. So finding ways where we can deliver better care in a sustainable way financially, so that there's enough money in it for them to be able to keep doing this with their existing patients, is something that we really want to focus on. So more directly, break even for physicians is one study a week. If they can see one patient a week to perform one of these PADNet tests, that is the break even for the expense associated with the technology.
So real quick follow-up, and then I know Kim wants to interject, but so I have to have a diagnosis, though, which typically, I mean, pain in the legs, I think, gets it covered. But I mean, I can't just, I mean, I can do these on my own, but or for free, right? But I'm not getting reimbursed. Is that correct? Okay.
Without indications in traditional Medicare or in commercial insurance, there needs to be an indication. Indications
and I
could
think
be
for most of these patients, high risk factors, right? High blood pressure, high cholesterol.
That's right. As you've said, if you have, this new research is showing it's even younger, but the traditional understanding is that if you are 50 years old or older with a history of smoking or diabetes, or if you're Medicare age, so say 65 or older, a third of those patients alone have P.A.D. And then as you have these other indications, that prevalence rate grows significantly.
What resistance do you have with the primary care and the podiatry offices as your sales folks knock on doors to try and urge them to integrate PADNet or P.A.D. testing overall into their practice?
Well, when they first wonder about the cost, and then we can show them that expense is not a hurdle. So that's not an issue. But we were speaking maybe offline before, but the concern that they're encroaching on another physician's business,
right,
especially vascular specialists, is a concern. That's why it's so critical to hear from vascular experts like Dr. Phillips that, in fact, they want to encourage that collaboration. Being educated to realize that they have access to these at-risk patients and a relationship with these patients that other healthcare providers don't have. So to leverage that so we can get better care delivered to their patients earlier is critical. Another concern is worrying about diagnosing a condition that they're not an expert in. And now they're in an awkward position of not knowing what to do other than saying you have a disease. So being able to collaborate effectively, remotely, securely with specialists so that they can get their impressions from a specialist and some ideas on how to treat this is extremely helpful and empowering for the primary care.
So let me ask you this, because there are some times when I'll get like a what are the lifeline or I'll get one of those. Yeah. I'll get one of those ABIs, and I'm like, there's no way that this is accurate because I can feel the patient's pulses. And so, have you experienced any pushback from people that run vascular labs or vascular specialists as like, yeah, your tests, it may, I don't believe it. And now I have to repeat it in my own lab, which I wanted to get to this too. We charge an exorbitant amount of money to bill for an ABI, which is I don't want to say what it is, but it's a heck of a lot more than I thought it would be. And so any opportunity to decrease the cost to the patient is fabulous. But getting back to my initial question, have you run into any pushback from vascular specialists? Like, yeah, I don't believe these results. I have to repeat them, do my ABI.
Well, so sometimes we do. And the reasonings behind those can differ. Sometimes it's because they would like to, for a business reason, do it. I also think, as Kim mentioned, our technology, we use the term ABI, and that is true in what we're doing, but we're taking some additional information as well. And so we really are excited and proud of the sensitivity and specificity of the technology, with over 1 million studies performed around the country. Thousands of practices. And as you might imagine, over that time, the technology has improved. So being able to take in that feedback, look to find ways to improve the technology is something that we're constantly looking to do. But my final comment on that is that I've really shifted our company's focus from being in a mindset of disease management to a mindset of health management. And if we want to be focused on population health, rather than simply focusing on, at the end stage when disease is so severe, how to at best save the limb, if not at least save the life, is I think a much more exciting way to look at it. And so getting to these people, getting to our population sooner with screening, it will be finding disease in mild and sometimes it turns out that under your expert eye, you would say they do not have disease. But I think the upside of taking care of patients with maybe having some referrals to you that turn out don't have a disease that's ready for you is well worth it.
And on that note, we're going to send it off to break. And again, when we come back in the last few moments, we're going to share with you how you can find a P.A.D testing site near you. So stay with us.
The waves were muddy. This is 860 AM. The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hey everyone, and welcome back to the show. We're talking to John Roman, CEO of Biomedics. They have a P.A.D testing device that they're providing to frontline doctors, especially primary care physicians and podiatrists, which I think is so important. I attend conferences around the world, and one of the biggest complaints from the vascular specialists is we're not getting these patients soonest. And why is that? It's because maybe primary care physicians around the world, there are a lot of them that may not be trained in P.A.D to a point where they can spot these patients in the earlier stages of P.A.D, so they're presenting later. And what Biomedics does is they're putting these testing devices in the hands of these physicians to be able to perform these tests in their clinics. And I think it's so important to have that because more than 70% of patients in our network with the Global P.A.D Association that were polled out of 500 said that when they presented to their primary care physician textbook symptoms of leg pain, neuropathy, leg cramps, they were misdiagnosed with diabetic neuropathy, back problems, arthritis, fibromyalgia, and old age. And so being able to get these devices into these clinics and being able to direct patients who have these symptoms and high risk factors, such as high blood pressure, diabetes, former smoker, current smoker, high cholesterol, etc., they can say to their doctor and actually choose a doctor that may know a little bit more about P.A.D. And that's why together with Biomedics, the Global P.A.D Association is launching PADtest.org. And that's where you can find a primary care or podiatrist possibly in your area that offers PAD testing and may know a little bit more. And the whole goal is not only to help educate the patients and to get them to the right doctor if they think they have PAD, but also to inspire other primary care physicians to want to be on this finder and be able to go to biomedics and say, hey, we want one of those devices in our clinics. We want to learn more about PAD and help to democratize access to this testing so we can prevent these patients from showing up a toe step away from amputation.
Well,
John, did you want to contribute? Yes.
It's the old adage, the eyes see what the mind knows. And, you have to be looking for it in order to, or know about it, but also be looking for it. But so I think it's fantastic. And over break too, we had talked about the fact that a lot of us are we're seeing a lot of patients who already have symptomatic P.A.D., but those that don't have symptomatic P.A.D. also need to be treated too. And I would have no problem if somebody sent me a result and they said, what should I do with this? And I would say, well, okay, they've got mild P.A.D. You need to do this, 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 and this. They don't have to come see me. And now you have hopefully gotten the person to maybe turn right instead of left down a road that leads to better longevity and less complications from P.A.D.
And on that comment, I think what we really love, and we get to live vicariously through care providers such as yourself, is that often as a patient, finding a session with a specialist, if it's then said, okay, we don't need to do anything, these are things we need to do, but it's a little catch and release, and that it's hard, given all the other demands, to stay in contact with that patient in a way that's appropriate. But primary care can. So
Right.
Part of that recommendation can be, we've talked about tobacco cessation, supervised exercise therapy, nutritional counseling, and then let's do a follow-up study in 6 to 12 months. Much more easily to do at a primary care setting. And then you have that ability to stay connected to the primary care community and those patients in a way that, again, I think is sustainable.
Yeah, and you haven't, so it's like you've tethered yourself. I personally have now tethered myself, or maybe the PCP is tethered to me regarding, okay, they've got a lifeline through a vascular specialist to kind of bounce ideas off of, or treatment plans and things. And then if and when that patient does become symptomatic, boom, I know about it and I can help them and get them expedited.
Thank you so much. John Romans, CEO of Biomedics, thank you for taking time. And I'm really excited about this partnership between Biomedics and the Global P.A.D. Association. If anyone wants to find a PAD testing site near them, go to padtest.org.
You've been listening to The Heart of Innovation with Emmy Award